Beautiful sky, gorgeous city.
I'm a practice pharmacist at the IMH group. From the USA to the UK, we have Dr Paul Grundy, who came to visit us in the UK. He is known as the godfather of the patient-centered medical home, and as well the founding and president of patient-centered primary care collaborative, and as well the IBM global director of the healthcare transformation, known on social media, the New York Times, the Economics, and others. Known as the godfather of the patient-centered medical home. An amazing opportunity to have you today with me, and I would like you to talk more about what's the pharmacist's role recently in the US, where they're going through, what's the updates.
So I recently was at a major university in the United States, and in the normal process of medical education, you have introduction to clinical medicine, where 4 medical students try to figure out for their first exercise the chief complaint of the patient. And instead of that happening, what they had was a medical student, a pharmacy student, a behavioralist, and a nurse. So on day 1, the medical students, the pharmacy students, the nursing students, the behavioralists were learning this is going to be a team sport. And as we have gone from a very few things we could do to actually treat a specific illness to hundreds, to thousands. I mean, the role of somebody who can really step in and help with medication management, who can support at a clinical level that transformation, has been a tremendous asset in this world of moving away from an episodic care into managing population pools like patients in medical homes. So all over the world, we're beginning to see the integration from the very beginning of education through treatment, where the role of the clinical pharmacist and the integration of the clinical pharmacist really become very important. So when you think about the role of the various providers in the delivery system, I think the conclusion that many of us have reached is that from the standpoint of the physician, there's 2 things they should be doing with their time. Difficult diagnostic dilemmas, because that's what they spend years training how to do, and relationships with their patients, right? I mean, I think that's what we really need to focus their time on. Over and over again in all these medical homes that I've visited, the sorting out of and the integration of the medication and the management of that medication into a plan is probably done better by somebody who's trained to do that. And the interesting thing, I think, in this transformation is that we are now, for the first time, really able to have the kinds of data, the kinds of information in a record about a patient that we can work together much more flawlessly as a team, right? Because what you need to get at the patient is there.
Yeah.
What he needs to get, or she needs to get at medication management, is there in the record. And I think that ability is really changing the whole role of what it means to be a pharmacist, what it means to be a nurse, what it means to be a doctor. Certainly what it means to be a patient. So no longer, I think, is the doctor the center of this universe and the data is stored in their head. I think the data is what is worked on active. And the center of the universe is the patient.
Yeah.
And so you see in these team-based models of care, patients in a medical home being an example of primary care level, much more of an integration, starting with training through delivery of care. And a huge, powerful key component of that is the integration
Of all those.
yeah.